Yeah, and I think that that's pretty common that when people are in this like acute, or you're in like a crisis stage, processing the emotions, that doesn't happen then for most people, right? It's like, all right, I have this oftentimes life threatening illness. I'm going to do what I need to do. I'm going to get through this thing. And then it's like, once, like you said, you're in remission, then all of the emotions that you did not have the capacity to process while you were in treatment are like, okay, and here, now it's time, and like you said, a lot of times that's when you don't have the support of the people around you because they're like, what? Snap out of it. Like, you're alive. You made it through this treatment. Hopefully they don't say snap out of it, but I know that some people do. Um, and so, yeah, I just think, for people listening to really hear that, because there is nothing wrong with you if after your treatment and you are in remission, or, something that you'd been working on, medically is fixed. It's not unusual for the emotions to come up after you are through the original kind of like health crisis. And I think that's so important. I've talked to so many people who have had that experience. And I actually had someone on the podcast, Vanessa, who is a big advocate for spreading awareness for PICS, so the post-intensive care syndrome. And, she talks a lot about that experience of people who've gone through this acute situation. They've survived, oftentimes with like low odds of survival. So that's very scary in itself. And then they're alive and they're like, oh, okay. And the depression and the anxiety and all of these different things can start to come up at that time when they're getting less support than they were during the treatment phase.
Absolutely. And we know that PTSD, right, post-traumatic stress disorder can happen from a
Yes.
critical care stay. And that's well documented. I think the other challenge too is that, many times, and I educate the learners that I have, medical students, residents, fellows, that when we take care of patients, and I do very often take care of patients who are in a critical care situation, so they have a breathing tube, they're on strong medications, they may seem like they're asleep, they may seem like they're sedated, but in truth, we know in retrospect that they can hear. Hearing is
Right.
often, they can have some awareness. And so I really try to say to them, when you meet a person who is a breathing tube and on strong medication, introduce yourself, say hello, speak to them as if they were awake.
Yes.
And right. And if you're going to do a procedure, if you can, if it's not a life threatening, this is an emergency, this has to happen now. And even if in an emergency, if you can speak it through, even better.
Yes.
If you can explain what you're doing as a clinician and doing it in a kind and gentle way, if you can, hold their hand, or if you can reduce their pain, or anything that you can do in that moment to, even in a very small way, to lessen that trauma that they may experience in that type of setting, then
Yeah.
that might be something that in a very small way could help.
Yes. That is so beautiful, right? Like, what a beautiful way to show up as a human supporting another human. And like you said, even if something is like an emergency, to talk through it, to talk as it's happening. So you're also still connected. They feel you there, right? I think, of somebody who may not be able to see or speak, but they're still there. And to know, like, your voice can be like a tether, right? To them, to know like that they're not alone in it. I just think that's really beautiful. And again, going back to, the system makes it really challenging to have a lot of extra capacity or to have extra time. But there are little things that you're teaching your students that they can do, even that aren't going to take extra time, right? Like talking it through with somebody, letting them know you're there, introducing yourself.